As busy cataract surgeons, we want a procedure that we can do. We don't want to feel like a failure if we were not able to implant something. It's really important that we're able to do a great procedure for our patients, right? And that's where learning curve comes in. And I can say with confidence that goniotomy with KDB has one of the shortest learning curves. So if you're thinking about getting into MIGS, I think this is a great place to start. It makes a lot of sense. You know, we're lucky to have a bunch of different MIGS devices, and I like to use a lot of them, okay? But one thing that I like about goniotomy with KDB is, as opposed to other MIGS procedures, which sometimes the learning curve is a little bit longer, I found that my learning curve with this device was actually shorter. It was very intuitive to use, and I wanted to see how my patients did when I had just started the procedure versus after having some experience with this procedure. And so I looked at my first 160 or so cases over the course of 6 months. I looked at my first 10 cases, and I looked at the last 10 cases that had at least 6 months of follow-up. And actually, the pressure lowering effect that I achieved with goniotomy with KDB was the same in both of those cohorts, meaning that the learning curve is not going to prevent you from getting great efficacy even with your first few cases that you're doing with this device.